Welcome to my initial presentation on cardiac anatomy. The overall idea of this is to explain how to interpret a ECG. And I want to start off like at the top of the heart. So this is the right atrium, and we can see here the sinus node is actually on the outside of the heart on the top right side between the junction of the superior vena cava and the right atrium. And then you have the crista terminalis running down the lateral wall of the right atrium. Then you have the fossa ovalis, which is between the right atrium and the left atrium, the coronary sinus, the tricuspid valve, and then inferior vena cava. So the right atrium is actually a relatively smooth structure. The entire posterior wall of the right atrium is very smooth. The anterior wall is a bit more muscular, and that's the right atrial appendage. And that's where most sort of cardiologists would position atrial pacemaker leads because it kind of gets stuck into the muscle. But interestingly enough, the right atrial appendage is pretty broad, so you don't tend to get clots in there in the same way that you would clots in the left atrial appendage. So if we look at this in a bit more detail, we can see the coronary sinus is very central to this image, and that's right down very close to the AV node, very close to the tricuspid valve. And the coronary sinus is the main vein which drains the heart. So we always talk about coronary arteries, but the coronary sinus is the vein. And all veins have valves. That's how they function. So veins kind of drain blood from structures. And here we can see there's a Thebesian valve at the orifice of the coronary sinus. So very interestingly here, we can see the sinus node is a relatively small structure. And this is your pacemaker. This is what keeps the heart going. And it's predominantly epicardial. So it's actually quite a difficult structure to reach in a EP study because most of our catheters are on the inside and that's on the outside. So the sinus node depolarizes from the epicardium to the endocardium. And if we look at the heart from above, we can see that the most posterior structure is the left atrium, the most anterior structure is the right atrium, and the right atrial appendage is the most anterior structure of all. And then we see the SVC, and connecting between the right atrium and the left atrium is the Bachmann's bundle. If we want to look at the structure of the right atrium, and one of the very common arrhythmias which can occur in the right atrium is called atrial flutter. And atrial flutter is a rapid tachycardia. It's usually at a rate of about 150 beats per minute, and it occurs around the right atrium. And one of the key components to this circuit is called the cavo-tricuspid isthmus, and that's the region between the tricuspid valve and the inferior vena cava. And we can see here an ablation catheter. And if you want to treat atrial flutter, you start off at the tricuspid valve and you pull it all the way back until you drop into the inferior vena cava. And we can see that some of these areas are relatively thin and you can actually see a light going through them. The thickness of the cavo-tricuspid isthmus really varies from part to part, and sometimes it's fairly thin, sometimes it's fairly thick. In terms of the right atrium and the left atrium, we can see here the right atrium, the fossa ovalis, the IVC, the right atrial appendage, and the left atrium. And you can see the connection between the right atrium and the left atrium is relatively thin. There are four pulmonary veins which drain into the left atrium. There are two on the left, which is the left superior pulmonary vein, the left inferior pulmonary vein, the right superior pulmonary vein, and the